Hello everyone, I did my presentation on lobular carcinoma in situ, and I will also refer to this as LCIS. So a little overview of the disease is that lobular carcinoma in situ, LCIS, is an uncommon condition in which abnormal cells form in the milk glands, known as the lobules, within the breast. LCIS is not a cancer, but being diagnosed with LCIS indicates that you have an increased risk of developing breast cancer. Here's a breakdown or description of the disease. So starting with the first bullet point, lobular, means that the abnormal cells start growing in the lobules, which in the milk-producing glands at the end of the breast duct. Next, we have carcinoma, which refers to any cancer that begins in the skin or other tissues that cover internal organs, such as breast tissue. Last, we have in situ, or in its original place, which means the abnormal growth remains inside the lobule and does not spread to surrounding tissues. People diagnosed with LCIS tend to have more than one lobule affected, but it does not spread to any surrounding tissue. As far as the pathology, despite the fact that its name includes the term carcinoma, LCIS is not a true breast cancer. If LCIS is detected in a breast biopsy, it doesn't mean that you have cancer. Rather, LCIS is an indication that a person is at higher than average risk for getting breast cancer at some point in their future. For this reason, some experts prefer the term lobular neoplasia instead of lobular carcinoma, and that's basically just a collection of abnormal cells. It also does not show or cause any signs or symptoms, such as a lump or other visible changes in the breasts. LCIS is viewed as an uncommon condition, and also it lacks microcalcifications in a mammogram. And as I stated before, LCIS may not always show up on a screening mammogram. One reason is that LCIS often lacks the microcalcifications needed to see in a mammogram. In more than half the cases, LCIS is multifocal, meaning that multiple lobules have areas of abnormal cell growth inside them. In about 1/3 of women with LCIS, the other breast is affected as well. Here is an image of how LCIS could look on a mammogram. Everything looks pretty quote-unquote normal. A patient comes in with a palpable lump that she may have. A BB marker is then placed on the area that the patient has felt a lump, and the mammogram is taken. Everything seems fine, so the patient will have a follow-up biopsy to examine the palpable lump. That's because LCIS does not cause symptoms and usually does not show up on a mammogram. It actually tends to be diagnosed as a result of a biopsy performed on the breast for some other reason, such as a suspicious lump or an abnormal mammogram. Modalities. We have, as I stated before, it doesn't usually show up on a mammogram, and although it is less likely to be detected on a mammogram than other types of breast cancer, a mammogram is still a useful diagnostic test. The types of biopsies that LCIS can be detected on can include core needle or surgical biopsies. A core needle biopsy is when a radiologist or surgeon uses a thin, hollow needle to remove several tiny samples. Ultrasound or MRI are often used to help guide the needle used in a core needle biopsy, And then a surgical biopsy is when a surgeon may perform an operation to remove suspicious cells for examination. As far as risk factors, LCIS is usually diagnosed before menopause. meaning less than 10% of women diagnosed with LCIS have already gone through menopause. LCIS predominantly occurs in premenopausal women with a mean age of 45 years old. A woman with LCIS has about a 15 to 30% chance of developing an infiltrating ductal or lobular carcinoma in the breast in which the LCIS is discovered, or in the contralateral breast. The risk of breast cancer in women diagnosed with LCIS is thought to be about 20%. Additionally, it is also extremely uncommon in men. And as treatment goes, LCIS does not require treatment in a way you might normally think of for cancer, such as needing to have surgery, radiation therapy, and chemotherapy. Because LCIS is an indication that a patient is at a higher than average risk for getting breast cancer at some point in the future, careful observation should be done by the patient with a provider to watch any signs of invasive breast cancer. The goal for that is to just watch for signs of breast cancer, and if signs do become evident, to act on them early. And this can include careful observation, which can be frequent self-breast exams. This can be done to familiarize patients with their breasts and detect any unusual breast changes. Another one can be clinical breast exams, and that's just manual exams performed by their doctor. And there's also screening mammograms that are done every year. That should be done every year. And surgery can also be done to remove the area of LCIS and a small amount of healthy tissue that surrounds it. May also be recommended for certain situations. Additionally, preventive therapy can be done, which involves taking a medication to reduce the risk of breast cancer. This includes medicine to block hormones from attaching to the cancer cells and medications that stop the body from making estrogen after menopause. So as far as the survival rate, despite the fact that its name includes the term carcinoma, LCIS is not a true breast cancer. Is not a true breast cancer, leaving the survival rate to be 100%. This is because, remember, LCIS is an indication that a person is at a higher than average risk for getting breast cancer at some point, meaning the risk is very low with this condition of its kind, like the risk of something happening while you have LCIS. Having this condition is not the problem. The problem lies when it spreads or develops to something else. And that is all. Thank you so much for listening. And here are my references. Thanks.